Hello, everybody. Dr. Unati here. I am coming to you live. It's a beautiful Monday. I want us to talk about something I always emphasize when I speak to my patients: vitamin D. We're indoors now, we're not necessarily yet exposed to sunshine, more especially us here in Canada. So I just want to remind everyone vitamin D is vital for our mental health. It's very important. I'll talk about three main benefits. One, it's a very good vitamin that is a fat soluble vitamin. It gets produced on your skin when you are exposed to sunshine. So hot places like in Africa, they are so lucky because they have sunshine, more especially people that live in the equator. They have sunshine all year round, so they're good when it comes to levels. And actually it contributes to how people feel. It's good for their well-being. So people that are in the North Pole, people that are in colder countries, us here in Canada, we need it. So I always emphasize to my patients, please take your vitamin D. Vitamin D, like I said, it's a fat-soluble vitamin. It gets absorbed by our skin into our body. What it does, it's important for our calcium absorption. Calcium, we know it's good for our teeth, it's good for our bones, and it prevents people from getting osteoporosis, right? So it's a very good vitamin that we need for our bodies. And also, actually, studies show that it prevents heart diseases, right? Of course, there's other causes of heart disease, but vitamin D plays a fundamental role in prevention of heart diseases. So please take a vitamin D, right? And it also boosts your immunity, your immune system. So it's very good. It's a very good vitamin. Honestly, I think it's cheap. Like I said, I encourage kids, adults, even if you are an old person, you are in your 60s, 70s, 80s, take vitamin D. I'm going to tell you here about the measurements, the dose that you need. And of course, studies also show it's also good for weight loss, right? So it does a lot of things. There's a lot of benefits, but more so, it's good for mental health. People that are at risk of depression or who are struggling with depression, it's part of the menu. I always prescribe it. It's very important for you to take it. It's good for that immune boosting purpose. It's good for that mood booster too. So check it out. Make sure you do it. So how we give it, if you are an adult, you are below 50 years. I'm not sure about the measurements in each country, but where I'm at, we use international units. So you take, if you are 50 and below, you take 1,000 international units once a day. And if you are 50 and above, you take 2,000. And of course, depending on your history, when it's too cold, it's in winter time, I always even pump it up. Even for myself, I take 2,000 because, like I said, it's good for the mood, like for everyone. It doesn't matter if you have depression or not. It's just a good vitamin, right? And it's good for the bones. For our little ones, basically, it comes in drops and it also comes in gummies. I give them, my kids, they take gummies, right? Depending on the age, check the bottle and see your child's age and your child's weight, and you basically give it according to that. Honestly, I even forget to stop it even in summer. I continue doing it for my kids so that I don't forget it in winter time. So it's a very good vitamin. Vitamin D is important. Nowadays, we are indoors, we are social distancing, we are inside. Please take your vitamin D, more especially, like I said, in countries that are not yet that cold, that yet warm right now. Make sure you do it. And even in wintertime, in places like South Africa now, I think you guys have wintertime is approaching soon. Make sure you do your vitamin D. You'll thank yourself later. It's good for your immunity. It's good for your mood. Take care. I hope you'll do so.